And good afternoon. I'm Jim Inkster, your moderator. Again, your number is 877-217-5757, the 58th program for Governor John Bel Edwards, who has dutifully come before the people of Louisiana in this fashion since April of 2016. And when the governor took office as governor of Louisiana, he left the Louisiana House after 2 terms, and one of the people he was elected with in 2007 was Representative Steve Carter, who died last night at the age of 77, another Louisiana victim of COVID-19. And Steve Carter was on the other side of the aisle from the governor, but I know you knew him well, and anybody who knew Steve Carter had to like him, Governor Edwards.
No, you're right, and you knew that he loved our state. He loved LSU. He spent a lot of time over there as a tennis coach and working in the with athletics. And you know, he leaves behind Gloria, a wonderful lady, 2 kids, 4 grandchildren. He was just a really good person, and as you can imagine, we had our differences of opinion, but I don't remember ever a cross word between me and Steve Carter. He was just a genuinely good person, and he will be missed. And you know, we also lost Frankie Howard, who was elected with us in 2007 and started serving in 2008 in the House of Representatives. This year we lost Reggie Bagala. I say this year, it was last year, who was serving in the House as a first term member of the House of Representatives. So anyway, this disease is real. It obviously is causing a lot of people to go to the hospital. It's causing a lot of people to die, and it's just so unfortunate. But I will tell you, Steve was a good person. He will be missed, and Donna and I encourage everybody to please pray for the family.
And also, Luke Letlow died, 41 years old, newly elected to Congress, and that shows that this malady can take anyone out at any age.
Well, I think he made 41 the day after the election that he won in early December, and as far as I know, no known comorbid health conditions that would make him more vulnerable to the disease than other people. But nevertheless, the disease did take his life, and that's extremely sad as well. And I guess that just underscores that this disease is real, and that we really ought to do what we can to protect our loved ones, our neighbors, our coworkers, just everybody, including ourselves, from the disease. And there are certain things that we know that work to reduce the transmission, like wearing masks and social distancing and washing your hands frequently, staying home when you're sick. And, of course, we can add to that now because since December the 14th, we've been administering vaccines in Louisiana. And so we also want people to get vaccinated when it is possible for them to do so.
And we're going to talk about COVID-19 and vaccinations and much more. It's been a busy month for the governor of Louisiana and for the nation at large. And we're in the first show of 2021. The governor a week ago would have been doing his show on the 3rd Wednesday, but he was in Washington for the inaugural. And I was thinking, Governor, that you've been in office now just over 5 years, and you've now worked with 3 U.S. presidents.
Yeah, I have, and you know, it's been my good fortune to do that. And I look forward to working with the Biden administration as best we can over the remainder of my term. And I will tell you that it was a surreal experience. I was really happy to be there with my son, who's a freshman at LSU, last Wednesday. But there were more police officers and soldiers than there were spectators at the inauguration. And I hope and pray that never happens again and should never be necessary again to assure the security of all the folks who are attending, especially the folks who were in the Biden administration going in, all the senators and representatives and so forth. But it was good to be there to watch history and make some contacts with not just my fellow governors, who I know pretty well, but some of the new senators and representatives and so forth. And look, there are no shortages of challenges facing our country right now, as we all know, and it's my hope that we can all pull together and be more united and be Americans first, and we can be Republicans and Democrats after that.
Last month on this show, you indicated that the election, in your view, was fairly handled in 50 states, all of whom confirmed the outcome, and Joe Biden won by over 7 million votes and received 306 electoral votes. But the president, Donald Trump, challenged that, and this riot ensued at the Capitol on January 6th, and now there is an impeachment trial. Do you think that's a good move for the country moving forward?
Well, first of all, I am very troubled by the president and I should say the former president and his approach. You got to remember that even before the election, he was saying there was no way he would lose the election unless it was stolen. So once he lost, he maintained that narrative, and he sowed doubt in his supporters' minds. And ultimately, it was the doubt and the concern and the allegations of fraud that was used as the basis for challenging the election results. It wasn't evidence. I mean, I think there were between 60 and 70 court actions. Not a single one found evidence of widespread fraud that would be sufficient to overturn the results in any state. And then to sow the doubt and then use the doubt as a reason to contest things, it just, it's very unfortunate. And I know there's a technical legal argument now, and quite frankly, I don't know enough to render an opinion, but there's a legal argument on the Constitution now as to whether a president who has already left office should stand trial on impeachment. And I know that I think both of our senators have said they believe it's unconstitutional. I don't know. What I can tell you is what happened, what played out across the country, and quite frankly, what was led by the president was very unfortunate. And I associate myself with the words that Peter McConnell used and Kevin McCarthy in the House of Representatives.
Governor Edwards' headline in The Advocate today: oil gas lease moratorium could hit Louisiana economy. Energy experts say already struggling industry could suffer long-ranging effects from move. What are your thoughts about this move by the Biden administration?
Yeah, and I think it's happening right now, and we haven't had an opportunity to review the executive order. Obviously, we're concerned about any moratorium that would affect the Gulf, and that's what we're talking about here, because I think the moratorium is on federal lands and waters, and we don't have land in Louisiana owned by the federal government to speak of where there's oil and gas production. So we're talking about the Gulf of Mexico. Clearly, we are wanting to do what we can to influence the administration coming out of the moratorium as to what's going to be in place going forward, so that we advance the interests of our state, but also of our country and energy security, and reassure the president and the administration that we can do it in a way that is conscious of our obligation to make sure that we protect the environment and so forth. We have a mature infrastructure in Louisiana, and actually there are many reasons why production activities in the Gulf are much better for the environment than production activities elsewhere. And so we want to have a good discussion with them, and we're already talking to various oil and gas companies and interests to make sure that we're coordinating as best we can. But also, we want to make sure that we are responsible when it comes to striking the right balance with climate change, which I happen to believe is real. But we're going to be in a transition for decades as we move away from fossil fuels and to clean energy and renewable energy. It's going to take decades, and we're going to continue to produce oil and gas. We can do that in Louisiana. We can do that in the Gulf. And we want to. I look forward to working with the administration in Washington to make our case as to why we ought to be able to continue that on the other side of this moratorium.
Jessica in Watson, you are on the air with Governor Edwards. Hi, Jessica.
Hey, how you doing?
Yes, ma'am.
My question is, Governor, how you feeling about supporting both bases here in Louisiana, both Democrat, Republican, and Independent? I'm more Democrat, my mom is more Republican, and we both support what you have done here in Louisiana, especially because she's an ER nurse.
Well, thank you, Jessica. And Jim, she cut out on me just a little
I
bit.
think
What was
she
the
was
question?
talking about crossover appeal to
Oh, yeah.
all people of political persuasions.
Yeah, and Jessica, first of all, thank you for the question. And I mentioned this at the outset of the show. If there was ever a time for us to be Americans first and not Republicans first or Democrats first, I think it's now. I think that's what's demanded when you have public health emergencies that come along every 100 years or so, like this pandemic. It would also be great to see it in the aftermath of what happened in Washington a couple of weeks ago, or 3 weeks ago, I guess it was, when there's no other way to say it. We had a riotous mob that was engaged in insurrection at the Capitol, attacking Congress and trying to prevent it from doing what the Constitution requires it to do. And we should never dismantle our fundamentals of democracy in order to achieve the outcome that we want in an election. And so I've tried to work very hard with the president, whether it was Obama, then it was Trump, and now it's going to be Biden. And so, irrespective of party, because I think that's what's essential is we try to govern and do the best that we can. And quite frankly, I try very hard to do that here in Louisiana with the legislature as well. And I have a very good working relationship with the vast majority of members of the House and the Senate, regardless of party. But it's a conscious effort, and it's certainly not easy. And I'm not going to say that I'm perfect about that either. But Jessica, I think you're right. Let's be Louisianans. Let's be Americans, and we can be Democrats and Republicans next time we vote. But that's a ways off.
Charles in New Orleans. Hi, Charles. You're on the air with Governor Edwards.
Hi, Governor. I was wondering. My question was about the extended benefits article that I saw was ending for unemployment. Their claim is they've got 5,200 residents only have claims. Now, I live in the quarter and work in tourism, and I can tell you those jobs, they're not coming back. I have lots of friends who haven't received benefits in weeks or months, who haven't been able to get their benefit. I, myself, have been trying for the past 3 weeks. It constantly says pending.
All right, Governor, would you respond to Charles?
Charles, thank you for the call, and I'm really sorry that you're having employment difficulties, and obviously this is across the state, it's across the country. At the worst part of this pandemic, we had shed 300,000 jobs. We have regained the vast majority of those. I think we're at about 90,000 job losses today, and so that's still an awful lot of our brothers and sisters, our families out there struggling. Mm-hmm. The extended benefits are obviously a federal benefit, and you've got to follow federal rules on that. And our unemployment rate has improved to the point where they're just not available in Louisiana anymore. And that was the 13-week extension that provided benefits to those who had already exhausted other state and federal benefits. And the fact of the matter is there were right at 5,200 or are 5,200 individuals utilizing that particular program. But the unemployment rate has improved to the point where we're just not eligible for that program going forward, which is a good thing overall, but obviously it's not a good thing for those individuals who are adversely impacted by it.
877-217-5757 is your number. Thank you, Charles. Let's go to Baton Rouge. Mike, you're on the air with Governor John Bel Edwards. Mike.
Yes. First, let me send my condolences. Out to Steve Carter and his families, because every person that passes away is not a number. It's a family. It's somebody's mother and father, brother and sister. And let me just say this. We've been in phase 2, Governor, since before Halloween. And to me, I see a lot of businesses, a lot of restaurants, a lot of bars not being accountable, not doing what they're supposed to do, and also grocery stores. My question to you is that why are we staying in phase 2? Why are we not penalizing these people? And when are we going to give seniors a chance? Seniors who don't have computers, when are you going to get a chance to get vaccinated? Because these people can't get vaccinated.
All right, Charles, you're on a mic, rather. Excuse me. You're covering a lot of ground, but Governor, would you respond to Mike?
Yeah. Well, first of all, Mike, thank you for the call, and I appreciate the sentiments that you expressed for Steve Carter. And he's exactly right. It isn't just Steve Carter. Every single one of the 8,688 individuals in Louisiana who've lost their life to COVID, they are real people. They are mothers and fathers and aunts and uncles and so forth, and we need to always be mindful of that, and that's one of the most important things. Look, I can tell you that I, too, am concerned that not everybody and not enough people are taking this pandemic as seriously as they should, given the positivity rate that we see on our tests, the percentage of tests coming back positive, the number of cases we have in Louisiana, the number of people we have in our hospital. Today we reported 1,625. And then the number of daily deaths. I mean, this is a very serious pandemic. Mm-hmm. And we now know we have the UK variant present in the United States and about 25 states to include Louisiana. We believe it's 50% more transmissible than the standard coronavirus strain that we've been dealing with primarily. And by March, it may be the predominant strain in our country. So we all have to do what we can. And I'm encouraging everybody to follow the executive orders that are in place, to use these mitigation measures because we know that they work. And quite frankly, it's not an onerous requirement to wear a mask and to distance in order to protect people. And we all ought to be mindful of those most vulnerable, those who are older, those who have comorbid health conditions. And those individuals should certainly not go into any indoor space where a single person is unmasked. They just shouldn't do it. That's been the White House guidance for weeks now. And I will tell you, we're doing everything that we can to make sure that seniors who are eligible for the vaccine, those 70 and older, are able to make appointments, whether it's using a phone, to call the providers who are administering the vaccine. If they can use an internet and their particular provider is making appointments online, then that's fine too. But we actually have 324 enrolled providers who are administering vaccine this week in all 64 parishes. And no system is perfect. Ours continues to improve every single week. We're making changes, but I can tell you we have about the sixth, last I checked, the sixth best utilization rate of vaccine in the country in terms of administering vaccine that's available as soon as, or very, very quickly after we get it. But Mike, we're going to continue to improve this process, and there was some good news that came out of Washington yesterday, and I'm thinking that Jim and I will get to that soon, about allocations of vaccine going forward.
Well, what about that, and what do you say to people who continuing to have aversion to getting a vaccine?
Well, look, the good news is that there's more demand than supply right now. So the vaccine hesitancy is not causing us a problem right now. We know at some point it will if we don't reduce that hesitancy. And all I can tell you is it is safe, it is effective. I believe that the Food and Drug Administration did everything that they needed to do to ensure that before they granted the emergency use authorization. It is the only way we're going to put the pandemic behind us. And what we're seeing is, and this is true anecdotally here in Louisiana, but also national polling, that over time, confidence in the vaccine is growing, and there's less resistance to it, less hesitancy. And so we're seeing that in Louisiana. And a lot of it wasn't, no, I'm never going to take it. It's, I don't want to take it now. I want to see what happens to other people that I work with or in my family if they take it. And because there are so few serious side effects and so forth, we're seeing more and more people step forward to take it. And I hope that continues, because the one and only way we put this pandemic behind us is by having enough of our people, and it's going to take somewhere around 70% of our people to be vaccinated, and the sooner the better.
You've been vaccinated, haven't you?
I have not.
You have not?
No, I want to do it. I absolutely believe in it, but I'm waiting to get to the order of priority that includes essential workers who are not medical providers, and including those who are first responders and emergency workers, like at the Unified Command Group at GOSEP. So I'm waiting my turn, but I'm anxious. I'm very anxious to do it.
Let's go to Christina in West Baton Rouge. Christina, you're on the air with Governor Edwards. Hi, Christina.
Yes. Good afternoon. Thank you for all you do, Governor. Is there any way the state budget could afford to replace the burnt-out lights on the I-10 Horace-Wilkinson Bridge? Not the decorative ones. I know that's privately funded, but it is so dark. I think it's only 2 or 3. And also the lights, the burnt-out lights extend all the way past College Drive.
That's the new bridge in Baton Rouge that Christine is referring to, if you're not familiar with the capital area. But, Governor, she says there's a light problem.
Well, and there's another problem. We're still referring it to the new bridge, and it's older than I am, I think, or it's close. But Christina, thank you for the call and the concern. The answer is yes. I'll get with Dr. Sean Wilson, the Secretary of DOTD, and in fact, if you're still on and you can give your number to the folks that you called in, I'll make sure that he calls you. But we will make that happen, and then we'll look at those lights as they extend across the beyond the bridge, going towards College Drive as well. You know, we need to upgrade our infrastructure for quality of life, for commerce, but also making sure it's safe. And so it's a relatively simple thing to do to make sure we have lights on. We'll get on that.
Mike in Edgard. Mike, you're on the air with Governor Edwards. Hello, Mike.
Hey, how you doing? Thanks for the call, taking my call, Governor. My question is about the equity of the people of color for the vaccine, and I was just wondering, would it be possible that, people of color 50 and older with underlying conditions be a priority to get the vaccines like right now?
Well, first of all, Mike, thank you for the call. And I'm not going to change the priority groupings so that we have African Americans at age 50 and above and whites at age 70 and above and so forth. That's going to be the same. But what we are trying to do to promote equity is where we distribute the vaccine to and the sites where we administer it. We want to make sure that it is accessible to everybody. So whether you have underserved areas that are inner city or in rural areas, and some of these may be inhabited primarily by African Americans, whatever, we want to make sure that that vaccine is available. We also have a challenge because this is just a fact. We know it. There is still more hesitancy in the African American community around the vaccine than in other communities, and we're trying to combat that as well. So I will tell you, everything that we're doing around vaccine equity is a big part of it, and you're gonna see as our allocations of vaccine doses increases, you're gonna see more strike teams that get out into areas where the vaccination rate is lagging, so that transportation isn't an issue, and they'll be scheduling appointments going into those neighborhoods and setting up a vaccination site. And you're going to see more and more of that as we move forward. In the meantime, I'm encouraging you, Mike, and everybody else, let's promote this vaccine because it is safe and effective. We need to overcome the hesitancy, and we need to make sure that people get vaccinated as they are able to do so, as they are in the priority group that's being served.
Your number is 877-217-5757. A line is open for Governor John Bel Edwards. And we go to another Christine in Livingston. Christine, you're on the air with Governor Edwards. Hi.
Hi. It's a pleasure to talk to you, Mr. Edwards. I voted for you and stuff. So. But my concern was about public schools. I have 2 daughters that are in junior high school, and we live in a very conservative area where the teachers don't wear masks, and they publicly say that COVID isn't serious and things like that in front of students, and students make fun of my kids for wearing their masks at school. And I'm just wondering if you guys are in contact with all of the parishes' school boards, and if you try to enforce it with them, or if you just kind of let them do their own thing based on the area they're in.
Well, they're not supposed. First of all, thank you very much, Christine, for your call, and thank you for taking this pandemic seriously, as we all ought to do. The Board of Elementary and Secondary Education, pursuant to legislation this past year, promulgated rules about how schools are to be operated, and it's from getting on the bus in the morning to arriving at schools, and how class is conducted, and masks are supposed to be worn, and everybody's supposed to be distanced, and so forth. And by the way, we know that if schools are conducted in that fashion, that it's not a major spreader of the disease. And in fact, the CDC just released a report this week that confirms this. But all of these precautions are required, and Bessie has promulgated those rules. And if the school district wants to avail itself of the immunity from civil liability that was put in the statute, they have to be conducting themselves in accordance with those rules promulgated by Bessie that are based upon the CDC recommendations. So I would tell you, if you've got teachers not wearing a mask, that is against the rules already, and all of the kids, especially those, and I can't remember if we exempted those who were especially young or exactly what grade that goes to, but they're supposed to be masked as well. And look, we all just need to do a better job, regardless of what we did yesterday or what we thought last week or whatever. We should all recognize that our country and our state is in a very, very difficult place, with a very high baseline of test positivity, cases, hospitalizations, and deaths. And we have new variants coming online that are growing in prominence that threaten that even further. And the only tool we have at our disposal is the mask, because we have masks for everybody. We don't have a vaccine for everybody.
877-217-5757. We will return to the phones in just a moment. And Matt Doyle is taking the calls and running the show today. Governor John Bel Edwards with us for another 20 minutes or so. And a few items from listeners who've sent messages to be forwarded to you. Here's one from Olivia. How can we have confidence that we will get our second vaccine? From Olivia Pass, Governor.
Well, we are holding the second vaccine, so you don't have to worry about that. That's something we're making absolutely sure of. And there was some states, and at one point, I think it may even been talked about at the federal government level, but the Biden administration confirmed yesterday they're going to stick by what the FDA approved in the emergency use authorization, and that is both the Moderna and the Pfizer vaccines are 2-dose vaccines. Pfizer 21 days apart, Moderna 28 days apart. And so every time we administer one of those doses to an individual, we are holding back the second dose. And we're going to make that second dose available to the same provider 21 days later or 28 days later, as the case may be. And you also are scheduling appointments for that second dose at the same time you show up for your first dose. So we're making sure that we're going to do that. And look, that's one of the reasons why states have been unfairly targeted for a slow administration of the vaccine, is because we're holding on to the second doses. And so it shows that we have them in our inventory, and we do, but it's not time to administer them. And if we were administering them all as we received them, then we wouldn't be able to do second doses. And so I do hope that people realize that's the approach we're taking in Louisiana. It's consistent with the FDA, the CDC, and both the Trump and the Biden White Houses with respect to their coronavirus task forces.
All right. The listener Ray in Hammond notes that the First Lady of Louisiana, your wife Donna, was a teacher for the reigning Heisman Trophy winner. That is correct, isn't it?
It is. So Devontae was a student at Amite Elementary School. She taught music there. And one of the things she loved about teaching music is she literally taught every student in the school for 1 hour a week. And so she got to meet all of the students, got to teach them all, and she remembers Devontae. He was a great student then. He comes from a really good family as well, and obviously we're very proud of him. And I think I may have told you this, Jim, but I used to be the biggest deal in AMEET. I am not anymore by a long shot. the Heisman Trophy is much more significant to the people there.
Paula in Metairie, we start the last quarter hour with you, Paula. Good afternoon to you.
Good afternoon. Thank you for taking my call. Governor Edwards, I just want to thank you very, very much, you and all of your staff, for all that you have done for all of us in this state with regards to your rules that you've put into effect. And I know it hasn't been easy. I worked in a hospital for 43 years. I'm retired now by the good grace of God. And I just want to thank you and all of your people for all that you've done. I know you've been criticized, which personally I think is very unjust, but I think y'all have done a tremendous job in keeping us safe. And I just wanted to commend you because I don't know if you get thank you enough.
Paula, thank you very much. And by the way, I was raised by a lady who was a nurse for about the same amount of time that you were. So thank you for that. And you know, first of all, we have an awful lot of people around Louisiana who do take this seriously, and they are determined to be a good neighbor and to protect their family members and coworkers and themselves by doing what's right. There are too many people who don't. And for some reason, Paula, politics has entered into the discussion as if the virus cares whether you vote Democrat or Republican or what your party is and so forth. And that's unfortunate. And then because we have too many people who don't do what's required to slow transmission, we are causing an undue burden on our healthcare delivery system. And we always talk about hospitals and beds, but as you know, Paula, it's the staff, it's the nurses, the respiratory therapists, the doctors, it's everybody. And for many, many months now, that strain has just been tremendous. And right now, we have 1,625 COVID patients in the hospital, in addition to all of the non-COVID patients. And so I appreciate you, Paula. Thank you very much for those kind words, and the entire medical profession for the work that they've been doing. They've been the true heroes throughout.
877-217-5757. Still time to talk with the governor of Louisiana, John Bel Edwards. William in Geismar. William, you're on the air. Hi.
Hi. Thank you for taking my call. Governor, I'd like to thank you for your service, both in the military and as a public servant. My question, I would just like to get your thoughts or your suggestions. How do we deal with the plague of disinformation just running rampant in this country, the truth decay that we're dealing with, the alternate realities? We seem to have two different realities in the country right now, whether it's election security or vaccinations or whatever.
Yeah, first of all, that is a great question. You know, I watched a program on Netflix a while back called Social Dilemma, and it really alarmed me to see how misinformation is. These campaigns are deliberate, and they're not just by individuals out there. There are algorithms that feed people information of the type that they want to receive, regardless of whether it's accurate, and it just reinforces things that they already believe or that they want to believe, and it's I think poses a real danger to society going forward. I do encourage people to try to get information from reliable sources. So if you want to know about, for example, the safety of the vaccine, go to the FDA websites, go to the CDC, look at the data that was presented and evaluated and what the emergency use authorization said. Go to the Advisory Committee on Immunization Practices and see why it recommended the different groups be prioritized as they have been and so forth. And I guess we're asking too much of people to do that, but there are really good, decent, intelligent people who believe the craziest things today, and it's really, quite frankly, hard to understand. And I'm hopeful we will do better going forward.
Now, next year in Louisiana, we have a U.S. Senate race, and then we'll move into the cycles for statewide races and then for president again. And those years go by quickly. And now many people have become comfortable voting by mail, but that process has been attacked. Do you think we will continue to have this large number of the populace, the registered voters who are casting ballots by mail, or will we be cutting back on that because of these claims of so-called voter fraud?
Well, I can't imagine in Louisiana we would cut back, because I don't know of any real allegations of fraud in Louisiana for elections going back some period of time. Now, as you know, the most recent elections that have been conducted during the pandemic, we have had emergency plans in place for those elections where you have more reasons for which you can request a mail ballot because maybe you're under quarantine or you're symptomatic or you have one of those comorbid health conditions and so forth. Obviously, if we don't have a pandemic, then those reasons will go away for being able to request a mail ballot. But Louisiana is not like other states, some other states at least, where everybody votes by mail, or anybody who wants to can vote by mail simply by asking. And so I wouldn't think that there's a reason to curtail that here in Louisiana. The group of people that most often vote by mail here are those who are 65 and older. And it's a courtesy that we extend to our senior citizens. So I can't imagine we're going to change that. At least I hope we don't. There's no reason to.
Another question from a listener forwarded to me regarding the Keystone Pipeline, Governor, and that project has been suspended by the Biden administration. Is that crucial to the well-being as far as the economy of our state?
I don't think it's crucial to the economy of our state, because we will source oil from other places, and our refineries will continue to run and so forth. So I don't know that it's crucial to our state, and to the extent that oil that doesn't come from Canada will instead come from locally producing wells, it could actually be a benefit.
Well, it's something that, of course, was a long time in the making, and as we know, there were people who were extremely passionate on this issue. And do you think the Biden administration will at some point relax these restrictions, or is this something that the state will have to deal with and the country?
Well, it's too early to tell. From what I can understand, they put in place last week a 60-day delay in certain decisions being made, and today, and I haven't been able to review it, issued an executive order with a moratorium on certain activities too. And I think they're going to use this time to try to figure out what the policy should be going forward, and that gives us an opportunity to try to make our case and influence what that policy, or those policies, I should say, should be. Going forward, and I look forward to having those discussions with the Biden administration, because I just know how important this is to our country, to our state, and it can be done and is being done responsibly. And we're not going to hit a light switch where we just stop fossil fuels today. There's going to be a transition, a bridge, if you will, that's going to take decades. And by the way, we ought to embrace the renewable fuels too. The number 2 economic development project in the country for 2020 is a project at the Port of Baton Rouge to create a diesel refinery using soybeans and corn as the ingredient to make the diesel. And so we have to embrace all of these things too, and to the extent that we can, wind and so forth. Because diversification really is the way to protect your economy, all the investment and the jobs for the long term. But I can tell you that the traditional oil and gas remains a very important part of our economy. It's where a lot of employees get their paychecks. And I will tell you, every time a coal-powered plant is closed and replaced with natural gas powered plants, the climate benefits, and so does the state of Louisiana.
All right. Last caller for Governor Edwards, and we have about a minute, so please be brief. Phil in Lafourche. Phil, you're on the air with Governor John Bel Edwards.
Thank you for taking my call. I just wanted to know how the governor feels about them skirting on the idea of a fuel tax.
What about a fuel tax?
So you're talking about a gas tax increase this year?
Yes.
Yeah, Phil, thank you very much for the call. And I'm sorry, it cut out on me a little bit as you were asking the question. Quite frankly, I don't believe it would be possible to get a 2/3 vote this year in light of the economy and what has happened because of COVID and so forth. And so I am not going to be supporting that this year. I will tell you that we need to make sure that we can take advantage of any national infrastructure initiative that gets passed and any non-federal match requirements that we have to be able to meet in order to get our fair share of infrastructure here in Louisiana from our federal taxes. We need to do that. And if they pass something that requires more than we can generate here locally, then certainly we will take that up. But I don't think this is the year to be pursuing.
Thanks for listening to Ask the Governor with Governor John Bel Edwards. This program is produced by the Louisiana Radio Network.